All right, so prior to entering the room, I'd review the patient's medical records. I'd make sure that I have an order to insert the indwelling catheter. I'd review their records to make sure there's nothing that interferes with the procedure. So look at their allergies, diagnosis list. I'd assemble my equipment out here, not before entering. And then I would acknowledge and introduce myself, acknowledge the patient. Hi, Mr. John Smith. My name's Shannon. I'll be your nurse today. I have an order to insert a catheter to help you urinate since you haven't been voiding. So before I'd start, I would verify their identity, but I would perform hand hygiene. I would check to make sure that it's the right patient. So look for 2 identifiers, the date of birth and the name. All right. And then afterwards, I would get started. Let's put the patient at a vertical height. And we want to make sure he's supine for the procedure. Okay, so I've performed hand hygiene. I'll go ahead and wear my gloves so I can palpate his abdomen where the bladder is to check for distension. And I want to make sure that I provide privacy at all times. So I would have closed the door, make sure that everything's private and that he's covered when he needs to be. So I would palpate the abdomen for distension. And then afterwards we would perform perineal care. Attached body. Okay. So I would use some mild soap and warm water, and we would just clean the area. Get rid of that. Get rid of that. Give them privacy again. Then afterwards, we would get our catheter kits ready. We would dispose of all of this. Okay, so prior to opening our catheter kit, I would wash my hands again, remove the wrapper. This one's kind of already open, it's been open. We'll go ahead and expose our patient, but make sure all the other parts are covered. We would also apply a water-resistant pad below here. And then we'll go ahead and move our kit here. Open everything, and we will try to maintain a sterile field at all times without touching any of the inner areas there. So I would apply my sterile gloves. Dominant hand first. Oops, got my nail there. Okay, we want to make sure our hands don't go below our waist. Make sure our side rails are up to make sure the patient's safe, and then we will take this drape here. With the shiny side down, we would place it below his thighs. And then we will take our next sheet, the sheet that drapes around the penis. That would go around like that. Or the other way. So next, we'll take our tray out. And we'll go ahead with we'll take the lubricant out, and then we'll dispose of that. And then we'll open up our swabs. There will be 3 in there. Get that ready, make sure it's on the sterile field. And we'll first open that. We'll cleanse the penis 3 times. So you wanna hold the shaft perpendicular to the body. And starting from the tip, you will go in a circular motion going around and you would do this 3 times. 2, 3. Switching swabs for each time, and make sure the swabs stay out of the sterile field. So next, we will take the wrapper off of our catheter. We'll take 5 to 7.5 centimeters, and make sure that, we want to make sure that it's 7.5 to 5 centimeters. And then we want to maintain a sterile field. I'd also uncoil this too. Let go of that. And that stays up here. Prior to inserting the cath, we'll lubricate it. We want to make sure that the port at the end, pretend like that's out of the camera here. We want to make sure that this is closed prior to inserting and that there's no kinks in the tube. But before that, we'll apply the lubricant. Some manufacturers require you to make sure that the balloon works. So you would take off the cap there, dispose of that. With your dominant hand, you would insert it into this thing, the port, and you would inflate the balloon. So I'd hold down on the syringe there and it would inflate. Afterwards, I would remove that fluid, and then we would proceed to insert the tube. So with my non-dominant hand, I would hold the penis perpendicular, and we'll go ahead and insert. We'll have the patient bear down, or pretend like he's voiding. I guess he'll have that sensation as we're going in. So you'll bear down kind of like you're voiding, and we'll go ahead and insert the tube. So that will go in. Usually you stop when you see urine coming through the tube, and you also want to make sure that you stop if they state that they have any pain, or if they, once you feel retention after inflating the balloon. So we'll inflate the balloon, remove that, get rid of that, and then afterwards we would let that go. We would technically take this off, but we don't want to rip it to use the kit again. And then we would provide privacy for him, and I would attach this catheter tube to his inner thigh with a strap there. And then prior to doing that, I would take off my sterile gloves, and we were going to get some new ones. So we'll remove that, wash our hands, put on some new gloves. And we want to make sure the tube of the catheter is unobstructed and not coiled up as we're taking it, as we attach it to the bed. When we attach it to the bed, you want to make sure that this is securely attached to the thigh, and we attach this to the non-moving part of the bed. And then if there is any urinary output, we want to record that. Then we'll clean our area, dispose of everything that we used here. Provide privacy once again for our patient. And we would have disposed of all of this. Ask him if he needs anything else before I go. I want to make sure he's at the lowest position again. Make sure his personal toiletry items are close. I would have also cleaned around that area if I noticed anything that needed to be cleaned. And make sure he's in a comfortable position. His call light is within reach. Is there anything else I can get you before I go? And then I would thank him for letting me take care of him, and I would leave the room. Get rid of my gloves, perform hand hygiene again, and then I want to make sure that I document the time, the date that I performed the procedure, how well he tolerated the procedure, the size of the catheter that I used. I would also record the urine output, the measurement and its characteristics. Afterwards, I would record the amount of fluid that I used to inflate the balloon. I would note any complications that I observed, and then last I would educate my patient on the catheter. So make sure that they tell you if it comes out or if they have any abdominal pain. And that concludes it.